So schizophrenia is a mental disorder, probably thought of as the most serious mental disorder one can have, and it refers to the inability of the individual to test reality or engage with reality appropriately, and therefore have experiences that are inconsistent with what other people experience in terms of that engagement with reality. These symptoms are hallucinations, which occur when people perceive a stimulus when there's no stimulus present. The most common presentation being hearing voices, and this is people hear voices when there's nobody speaking to them, but they think that these voices are real. But hallucinations can occur in any or all of the sensory modalities: touch, vision, taste, smell. Then the other symptom is delusions, where you have beliefs that are, again, irrational, illogical, but which cannot be challenged by logic or reason. And these beliefs are fixed and false, and include things like the belief that people are trying to harm you or interfere with you or hurt you in some way, called persecutory delusions. Delusions of reference, where you think people are talking about you when there's no evidence to support that. Delusions of control, where you think that something or some force is controlling your actions and have taken over your will. And there's several others. And then these two experiences, the hallucinations and the delusions, then of course cause you to engage in behavior that is overtly different from the average other person and can separate you. And this behavior, of course, includes actions, but also includes speech. And other manifestations that would suggest that the person is experiencing these psychotic symptoms. So those are the things that must be present, and then the things that must be absent now would be a medical condition. So sometimes people who have tumors in their brain, people who have abused substances, people who have low or high blood sugar can have similar symptoms, but these symptoms are due to the physical condition. So it is always important that people who are being diagnosed with this condition are medically examined to make sure that there are no physical conditions that could be causing it. And of course, there must also be the absence of mood symptoms, because people who are depressed, people who have manic depressive or bipolar illness, can also have psychotic symptoms that I described, but those tend to be consistent with the mood symptoms. So the absence of mood symptoms, the absence of substance use, the absence of medical conditions, and the presence of either hallucinations, delusions, or strange or inappropriate behavior or speech would be the way in which schizophrenia is diagnosed. A common misconception is that it refers to split personality, but that is not so. The condition of split personality is described in psychiatric and psychological terminology as dissociative personality disorder, which is a very different entity. The split that occurs in schizophrenia is really a split between body and mind, meaning that the experiences of the body, and of course through the body we engage with the world and engage with reality, these experiences are split from the experiences of the mind, so that what the mind perceives is not consistent with that reality and leads to behavior that is inimical to the person's interest in terms of dealing with reality. Well, it's difficult to comment on whether they should or should not be afraid. I mean, the behavior of somebody with schizophrenia can be quite bizarre and unusual and sometimes even frightening. I think that the fear of violence may be misplaced, because people with schizophrenia are no more likely to engage in violence than the average person, except where drug use is involved, and that also applies to the average person. So the fear of violence might be misplaced, but people with schizophrenia can become aggressive at times, and because of their strange behavior or strange speech, people do feel concerned that they may unpredictably engage in some kind of threatening behavior. But the reality is that that is very unlikely. Well, in essence, it's thought that people who are genetically predisposed to developing schizophrenia, if they use marijuana, they are more likely for that marijuana use to precipitate a psychotic episode that could then lead to schizophrenia. So it seems that if you're genetically predisposed and you use marijuana, then the likelihood of developing schizophrenia is much higher. In addition, the amount of marijuana that you use, the type of marijuana, and the age at which you start are also implicated. So if you start at a very young age, and by very young, we refer to puberty, early adolescence, so let's say between 11 and 14. If you use marijuana with high THC content, and if of course you smoke a lot of marijuana, your risk also increases quite significantly. Internationally, it's thought, and there is as well some controversy about that the prevalence is about 1%, which means 1 in 100. That is again lifetime prevalence. The incidence, which is new cases, is about 0.1%, which is 1 in 1,000. It's thought that there are variations in different cultures. In cultures that are more rural, the incidence might be less, and therefore the lifetime prevalence might be less. In cultures that are more urban, it might be a little more. And of course, in cultures, again, where there's a lot of substance use, marijuana for example, it might be a bit higher. If the treatment facilities are not as good, you might find that might also cause the prevalence to increase, because people are not getting treatment, and therefore there are more people living with the disease in its active state. So there are lots of factors, but they kind of rounded off to that 1% rule, 1% for prevalence, 0.1% for incidence. Well, it's thought that the early adulthood, late adolescence is the peak period. Usually in adolescence, people enter into what is called a prodrome, where their functioning might be slightly compromised, their behavior might change slightly, there might be a little decline in their academic functioning and social functioning, and sometimes they even have depressive episodes. But these then evolve into a full-blown psychotic episode. Now, not everybody who has this prodromal experience eventually develops schizophrenia, but certainly everybody who does develop schizophrenia has had that prodromal experience.